تعملي الماوس إذا أريح لك ولا؟
اي حدا بيسجل الايميل جاست نبعثهم الريسورسز.
السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم، الحمد لله والصلاة والسلام على رسول الله سيدنا محمد وعلى آله وأصحابه أجمعين. حياكم الله جميعا وأهلا وسهلا بكم في هذه المحاضرة وورشة العمل المهمة جدا مع أستاذتنا وعالمتنا الدكتورة رانيا ممدوح، أستاذة الطب النفسي والصحة النفسية في جامعة القاهرة، وكذلك صاحبة الاختصاص والأعمال الطيبة المباركة في مجال الصحة النفسية للمراهقين ولأبنائنا وشبابنا وكذلك للنساء. أختنا الدكتورة ممثلة إفريقيا في منظمة الصحة النفسية ممكن هي تتحدثكم عنها أكثر إن شاء الله في المقدمة، لكنها يعني لها إسهامات كبيرة جدا في مجال التربية الأسرية والصحة النفسية والطب النفسي بشكل عام. واليوم إن شاء الله سنتحدث عن مقدمة في هذا المجال للأسرة عامة، سواء للآباء والأمهات أو للأبناء. وستكون بدنا نوصل أحمد مع الدكتورة، الله يرضى عليك.
وعليكم السلام ورحمة الله وبركاته.
جزاك الله خير. فإن شاء الله هذه ستكون أقرب إلى ورشة عمل. مع الأسف الطقس لم يساعدنا لم يساعدنا في هذا اليوم لنكون معكم في يعني حضوريا أكثر، ولا للأسف يعني صار إلغاء لكثير من الأنشطة، ولكني ما أحببت أن تلغى هذه المحاضرة لأسباب. أولا الدكتورة ستسافر في 25 الشهر، فللأسف ستسافر ومش رايحين نستطيع أن نحظى بهذا اللقاء المباشر معها، فحياها الله. وثانيا يعني لسبب آخر، أنه حتى لو كان عندنا طقس مناسب ولا غير مناسب سنحتاج إلى أكثر من لقاء، وخاصة تتعرف عليها الجالية والمجتمع المسلم للمساعدة في المشاكل العائلية والفردية في مجال الطب النفسي والصحة النفسية. دكتورة أهلا وسهلا فيكي. المجال مجالك والمكان مكانك والمحاضرة محاضرتك والورشة العمل ورشتك، فإحنا اليوم جايين نتعلم منك ونسمع لخبرتك. دكتورتنا معها دكتوراه في أيضا في مجالات الطب النفسي المتعلقة بالومن النساء والمراهقين والإدمان. يعني هي قضايا من أهم وأعظم القضايا التي نحتاجها. فإن شاء الله دكتورتنا ستحدثنا أكثر عن نفسها، وهي دكتورة من كاليفورنيا، فهي لها خبرة بواقع الجالية المسلمة في أمريكا ومطلعة على بعض القضايا مباشرة. فإن شاء الله للتعريف بها مهم جدا حتى تستفيد منها الجالية في معالجة المشاكل الواقعية التي تحدث عنها يوم الجمعة. وبارك الله فيكم، ومع أستاذتنا الكريمة.
السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. تمام. السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. It's my pleasure, it's my big honor to attend with you today this workshop. This workshop is totally dedicated for our next generation, our young adulthood, the most precious, I think this is the most precious gift we are living for, or our next generation, our young adulthood next generation. It was a coincidence that I'm here with you today. I just came to the US for two other purposes: to visit my family and to attend the ICU DDR. ICU DDR meeting is an international consortium of universities for curriculums for drug demand reduction. This is an international association. The base was in Florida, Miami University, and the president of this association is Dr. Kimberly Johnson. We are dedicated all over the world to make an anti-addiction movement, an anti-drug use movement among the young adulthood in your universities. My name is Rania Mamdooh. I am a professor of psychiatry in Cairo University in the addiction psychiatry unit. And I'm working with the women mental health in a private center in Cairo, and another mental health for addiction and psychiatry in Cairo too, and another one in Sultanate Oman, and the North Africa representative in the ICU DDR. I'm so much interested in decreasing substance use and drug use among the young adults. I'm here today to talk with the families and the young adults, if they can come, to talk about how to promote our mental health among the family. We're living in families, maybe 4 members up to 10 members, the wife, the mother, the father, and 2, 3, 4 siblings, different ages. All of us are facing a gap presented between us and the next generation because of the Let's talk about mental health. Let's talk about what is the meaning of good mental health. There is an organization called World Health Organization. The World Health Organization is defining that if we are mentally healthy, it means that we know our positive abilities and we know our negative, what we cannot do, and we are able to cope with the stress, and we are able to study or work productively, we are able to get promoted, we are able to gain money, and we are able to make friends and surroundings inside the environment or the community. If those criteria are present in a person, it means that he is a mentally healthy person. A healthy person, again, he knows what he can do, he knows what he cannot do, he knows his positive traits, he knows how to cope with any sad event or surprising event in his life, and he can work or he can study effectively, he can earn money, and he can make friends and good, positive surrounding people. This is the definition of how to be mentally healthy according to WHO. Okay. This year interest of the WHO is to take care about people and environment. People and environment. Why people and environment? Because there are rising and more rising of problems, more rising problems in between among the people in several communities. The main issue now that makes the persons vulnerably cannot be mentally healthy, that certain communities, we're facing internationally migrating communities. Many people who are currently migrating from a community to another, a country to another. Many people face certain wars. Many people face certain immigration because of poverty, because of wars. They are entering into new communities with new cultures, with different ethics, with different interests. They're moving, and their siblings are moving. The young adulthoods are moving together. So they are facing the same problem, that new communities, new ethics, different cultures, different people living with each other, and we have to be, and we are asked to be a mentally healthy people. So the WHO chose that this year you should take care about people and the environment they are living in. Okay, so this is the international interest. What about the US status? And what about the Muslim status inside the US community? I want to revise with you certain data resulted from researches, scientific researches done in the US for the last 4 years. The Muslim teens attempt suicide double the rate of the other communities. This is according to the Mental Health Foundation research published in April 2021. Another research revealed that 8% of Muslim communities' young adults attempt suicide. 8%. This is according to the Psychiatric Times journal. A third fact, suicide is the second leading cause of death for children, adolescents, and young adults between 15 and 24 years. And this is according to American Academy of Child and Adolescent Psychiatry, the last meeting, June 2021. More than 11.8 million young adults reported the use of cannabis between the age of 14 and 22. This is according to the research of SAMHSA. SAMHSA is like the Ministry of Health regarding drug abuse and mental health in the US. The big body in the US dedicated for mental health and drug use. Vape and marijuana use rises tremendously between the age of 19 to 22, according to the NIDA. NIDA is the National Institute of Drug Abuse here in the US. The 2021 report. Teenagers are more likely than young adults to become addicted to marijuana or prescription drugs within a year after trying them for the first time, according to a new study by the National Institute of Drug Abuse, the NIDA, April 2021. Domestic violence is a cause of 45% of PTSD cases in young adults. This is according to the American Psychiatric Association, APA. The domestic violence, what do we mean by domestic violence? There are 6 pictures or 6 types of domestic violence. The young adult can experience domestic violence. He can be beaten or injured by one of the family, or he can only witness violence inside the family. He can only hear his parents argumenting together or beating each other in another room. He can witness firearm or a weapon at home. He can witness his father coming back to the home, or his mother or an older brother under the effect of alcohol, under the effect of certain substance, making aggression at home. He can witness the police arresting one of the family members inside home. All of these pictures are called domestic violence. Domestic violence is witnessing any violence inside home, not only being beaten or insulted. No, even aggression with two other members away of the client, away of ourselves. Domestic violence, again, is the cause of 45% of PTSD cases. What is PTSD? PTSD is post-traumatic stress disorders. The disease, it's a collection of disease in psychiatry related to stress and trauma. You know what does it mean by trauma? Trauma is a painful event that the person tries to forget and he cannot forget. And he memorizes it and memorizes it and memorizes it again, up to preventing him to study, preventing him to go to exam, preventing him while driving. Memories that come against the will of the member, of the person. These are called stress and trauma diseases. 45% of the young adults who faces domestic violence go into trauma and go into stress diseases. Another fact regarding the minor communities in the US, an online survey, a very interesting survey, among 11,800 students between the grade 10 and 12. It was done by the SAMHSA too. The ministry, it's like the Ministry of Health here in the US. It's done and revealed that 70% of the students expressed gender dysphoria, homosexual fantasies, conflicts between personal ethics and community pressure. What does it mean? Gender dysphoria. Gender dysphoria, it means that the student, 70% of the students between grade 10 and grade 12, they started to question themselves certain questions like, why I am a man? Why I am a girl? Why shouldn't be a man? Why shouldn't I be a boy? Do my gender roles are good for me? Am I able to be fit as a man? Am I able to be fit as a woman, as a girl? Am I appealing? Am I not appealing? These are called gender dysphoria. Homosexual fantasies. Since I'm not able to make sex with another, a girl or a boy, what if we do sex with the both gender, with the both sex, a boy with a boy? Is it halal? Is it not halal? Is it legal? Is it not legal? Will my parents accept that? Will I be pleasured? I won't be pleasured. So these are called fantasies, thoughts that are coming in the brain and the mind of the young adult, and it's consuming of his time, and we don't know what are the result of those discussions, inside discussion in his mind. Conflicts between personal ethics and community pressure. Our young adults either came from other communities to the US for the last 10 years, 15 years, or they are really born here in the US and we came and they are born here. Both young people, other than the other minor communities, the conflict between their ethics and the community pressure is much more than the other minor communities in the US. The Muslim communities in the US face conflicts more than the others, more than the other communities. Let's imagine together the day of a young adult or an adolescent, since he wakes up in the morning until he gets back to home at night. Let's imagine together. He wakes up and he prays inside home with us. He has his breakfast and he goes to school. In school, he hears about why do you pray? He hears about why you left the party yesterday and you didn't go with us for drinking. The girl is obliged to defend herself why she doesn't have to have a boyfriend like her other peers. Why are you really away of us? Why you don't go with us for the bar or for the restaurant, or you don't have lunch with us? Certain families in our Muslim communities encourage the boy and the girl to be with other Muslims and get back of the others. The young adult, automatically, he loves to obey his parents and he loves to make them happy. But at the actual daily life in the street and in the community and in the school, either he does that and he becomes alienated, or he does the opposite and he becomes fitting or appealing, but certain conflicts happens. Either I am healthy and I know how to smile, how to defend my ethics, and how to be with the others with my boundaries, my chosen my decisions, my power of self-assertion. I'm asserting my right to be sober. I don't like drinking, but you can drink as much as you wish, but I'm here and I want my brain alert, and I know how to be happy without alcohol. I know how to play sports without marijuana. I know how to have many friends, boys and girls, without getting into emotional relation with someone and getting into sexual relation, in order to be a man, in order to be a good girl, in order to be appealing, in order to be fitting in. So we need that our young adults to be highly mentally healthy, so they can assert the right and they become less conflicted in the community. These are the facts about US communities, in the Muslim communities. Another study done by as you see, the National Institute on Drug Abuse in 2019. And they, can you see the difference between 2017 and 2019 among college students? 6% they were vaping nicotine, compared to 22% were vaping in 2019. Compared to non-college students, in 2017 they were 8% vaping, compared to 18% after 2 years later. What about amphetamines, stimulants? What about inhalants? You know the inhalants? In the US, some inhalants are very popular. The cough medicines and certain other medicines. You see at the left side of the slide, 2015 and 2016, you see how the curves of the cough medicine is rising until 2020. It began by less than 2%, then it rises more than 6%. The light blue is the amphetamines, how it was in 2016, then in 2020, and how was the inhalant in 2015, and how was it in 2020. All kinds of drugs are rising. The whole reports with the NIDA, the SAMHSA, the National Institute of Drug Abuse, in all communities, not only the Muslim communities, the drug use are rising, all the kinds. What about prescription drugs? These are a disaster. And no one, a little care or a little spotlight is put on it inside the US. Prescription drug use, that the young adults now prefer the prescribed drug use instead of the marijuana or the cannabis or the spice or the tramadol or heroin or alcohol. Why? Either it is present in the cabinet of my mother, so I can take it since it is a prescribed medicine, so it is a medicine, so it cannot be dangerous. This is a one way to think for. Another way that Adderall, it increases attention. I saw my colleague at school, one of the doctors prescribed for him Adderall, so he got 98. He got 97 out of 100. And I'm studying the whole year, and I got 92 from 100, 93. How is that? How taking Adderall increase my attention and my concentration, and my other peer got higher grades than me while I am studying and he's not. This is a second way of thinking. That's why Adderall is widely and tremendously spread among our community. It's a medicine. I'm not doing something wrong. It's nothing wrong to take it. My other colleague is taking it and he gets grades. Another medicine called Concerta. Concerta is very dangerous. All of these, Ritalin, Adderall, Concerta, and Ritalin are very well known medicines prescribed for the attention deficit hyperactivity children to help them to increase their attention and to increase the amount of studying hours. Instead of 20 minutes ability to study, up to 2 hours per day ability to study. But the normal healthy young adult or the adolescent is not allowed to take it, because the more and more all of those medicines do have addictive abilities, do have addictive effect. So the normal adolescent, when taking Adderall 3 caps, then 10 caps, then 15 caps per day, then 7 caps per day, it won't be healthy anymore, it won't be for medical purposes, and it leads to more psychosis, more doubting the others, more suspecting himself, more suspecting the others, more overactivity, with little goals. He moves a lot, but he produces a little. His activity is not equal to his production. This is called overactivity. The sedatives are highly addictive. The hypnotics that induces sleep, sedatives that induces relaxation. All of those medicines are rising among our community for many unhealthy thinking ways, although they're not, they're addictive. So, why? Why all of this is happening? Why the teens are double suiciding more than the other community? Why they attempt suicide? Why they're dying more than the old? Why the vape increase? Why marijuana increases? Even after legalization, now we have another disaster called legalization of marijuana. Okay, so marijuana is no more is no more bad, is no more illegal. Why trauma? Why stress? And why gender dysphoria and thinking about our gender, thinking about our sexual life? A very nice research, a very fruitful research done also by the SAMHSA. I'm telling you, the researches, we can discuss researches from all over the world, but it's very good when we talk with our teen to talk about the same community they are talking with. If they are defending the idea that marijuana is legal now, okay, so we should answer and we should discuss with them from researches done in the same community who legalized marijuana. So the stigma, the first reason, the first cause who resulted in high suicide among the adolescent is stigma. Our communities are stigmatized to seek help, are stigmatized to see that there is a problem, are stigmatized that the uncle knows, the aunt knows, the granddie knows in the other country, the teacher knows, the neighbors knows, the police know. So we have a stigma that if my son or my girl has a problem in aggression, impulsive, she cannot study, he cannot study, he gets back late, he gets home late, he has depression, he has anxiety, he tried marijuana 3-4 times, he's drinking alcohol. Any of those problems, he tried suicide, he committed suicide, he attempted suicide. We moved to the ER, we moved to emergency hospital because our girl self-injured herself. We moved with our boy to the emergency because he moved a knife in the face of his mother. All of those issues are a stigma, unfortunately. So we're not able to think that, no, these are medical problems, and they have medical and scientific treatment ways, and these are not a stigma, this is not a catastrophe, all of these are symptoms in a medical disease, and these symptoms has treatment ways. The refusal to seek psychiatric advice. Okay, some families do know that they have problems, do know that the son or the girl has depression and anxiety, mood problem, anger issue, drug use problem, educational attention problem, but they refuse to go to a psychiatrist. Why going to a psychiatrist? Psychiatrists mean that the whole family is ill. Psychiatrist means that I am a bad father, I'm guilty, I didn't raise well, I don't take care of my children. No, all of those thoughts are highly negative and non-productive thoughts. I may have a child or an adolescent with psychiatric problem, yet I'm a good father, I'm caring, I'm not the reason, I'm not guilty. Denial. Another kind of parents do not know that they have a problem. They are not aware that that coming back late and having red eyes while entering home, it means that we may have a problem of marijuana. They don't know about that. They don't know that sleep disturbances is a sign. They don't know that the decline in the educational profile or educational performance of the child is a sign. The anger issues, then next day he's very happy, then the day after he's angry or for unknown reason, then the next day he's crying, then the next day he's out and they're not aware that this is a sign for a disease. So third reason for the rise of drug use and psychiatric problems in the minor communities are denial. Exposure to violence, we've described that. This is the fourth reason. Impulsivity. Certain children and certain young adults are impulsive by genes, genetically. They are impulsive. It's not from the environment or from the raising, the quality of the parents. Genetically, they do not think enough before acting. They take decisions with little time for thinking, with the decision consequences. Usually they make many mistakes out of the reckless while they are acting. Usually throwing things, forgetting the places of certain things, forgetting the bag in the school, forgetting things in the car, going into a certain place to do a certain goal or task, then coming back home, forgetting to do the task. All of these are signs. Our role as parents to take care that our young adult may be impulsive, may be aggressive, may be with disruptive behavior. He lies a lot. He fears to say the truth. If he makes mistakes, he prefers to lie and to hide the mistake instead of telling Mama, Papi, I did that, and I'm sorry. Tell me how to fix it. Let's help each other to fix it. No, certain disruptive behavior like hiding things, stealing, lying, lonely. He prefers to be lonely. He prefers not to talk a lot. He prefers not to defend himself. He doesn't like to say and to talk about his preferences. He loves the red color instead of the blue color. Even he loves the rice more than the meat. Sometimes even the minimum expression of preferences, the young adult is raised without talking about those even simple things. So if he's not talking about these simple things, he's definitely not talking about what's happening between him and his friends. What is the kind of bullying he's facing at school? What kind of criticism he's taking from his friends in the community? What is his personality at school, and what is his personality in the community, and what is his personality at home? He may be very quiet at home, yet in the community, he is very energetic, he plays, he loves, he's a leader. Maybe he's a leader outside home, and inside home, he prefers to be silent. Those things are called disruptive behavior. The access of firearms, this is our sixth reason for the rise of psychiatric problems or mental health problem among the minorities of minority communities. Bullying. This issue is not took seriously in the minor communities. When the young adult, and we are saying that we don't like to say that they're children or they're adolescent. The young adult term is literally the right one. The young adult. He's the coming adult, and he is now the young coming adult. So either, if we think about our son and girls, that they're coming young adult, we have to discuss with them. We have to listen. We have to sympathize with them. We have to imagine their days. We have to imagine the kind of bullying. Yes, you are the one who's coming from blah, blah, blah. Oh, of course you're not going with us because of your veil, because of your, the prayer. Oh, you don't have, he never comes with us because he doesn't like us to drink. Even the girls meet a lot of bullying, and the majority of our young adults do know how to cope with the bullying, do know how to react by letting it go, not leaving the bullier or the one who with the bullying act, not letting him be happy with his actions. Most of our young adults know how to let them know that the bullying action is not efficient for us, will not affect us, will not influence us. Yet we have another minority in our communities of young adults who are very influenced by bullying. They prefer to be alone. They get angry. They decide to go into the community and to be another personality than the personality at home, so they solve their problems. Since my father and mother wants me like this, okay, I am like this. But in order not to face bullying in the community, so I'll do this and this and this. And here begin the gap. The gap between us and the generation grows gradually, because of those cumulative events who is happening to our young adult along the day, and we are not imagining it seriously. We're not taking it as it happens. It is happening, and it is stressful. On a growing brain, his brain is growing, is still growing. He cannot defend himself as a one with 30 years old experience and 30 years old of age. Feelings of hopelessness and helplessness, and this is another disaster. When an 18 years old boy, an 18 years old creative, intelligent girl, creative, intelligent boy start to feel hopeless in the new community or his own growing community because he's fitting nowhere. He's not accepted by his parents. He's always blamed of his grades, blamed of not being regular on prayer, blamed of not playing good basketball beside the education, blamed of coming back late, blamed of his hair, of his style of clothing, of his way of talking, of the singers he wants to listen, the songs he loves to listen. These things he's blamed about. Helpless. He faces things outside home he cannot tell about inside home. The home ethics are against. He's conflicted. He's helpless. Acute loss or rejection. The last reason for the rise of mental health problems among minor communities is a sudden loss. Someone lost his parent, terrible accident, death of one of the parents, bad event, rejection. The father kicked him out. The mother is kicked out of home in front of her son and daughters. The whole family is out. The father is kicked out by the mother. All of those things are terrible events for the young coming adults. From all of those problems, we choose one problem today. As parents, we need to be ready to cope, to discuss it with our young adults. I'm not able today to talk about how to prevent suicide in the young generation, then depression, then the anxiety, then the trauma, then the domestic violence. It's too much for one course or one workshop. So now, today, I'm going to focus and let's learn together and train ourselves how to deal about the marijuana issue in the community. How to deal about the legalization and the marijuana becomes legal now. How when I have a 16-year-old, like our loving young adult back there, you. And this loving young girl here, okay, how when they come to their parents and see that my friend did that, my older brother did that, my neighbors are doing that, the odor of the party yesterday was like that, how we are going to discuss with them what is marijuana. They know a lot about it. They hear a lot about it. Maybe they know about it more than ourselves, but the readings and their knowledge about it, is it scientific or no? Is it from a textbook? Is it from the Google? Is it from a man taking cannabis? Is it from a dealer? We don't know. So let's talk about it. Before talking with our young adult about marijuana, let's know ourselves what marijuana do in our brain. This is a cut section of the brain, as if we have the brain and we cut it from the center. And this is a view, a lateral view from the brain. Here, are you seeing the cursor? Ah, okay. This is the frontal part of our head, the brain. This is the decision-making center in our brain. Behind it, there is the movement center. Behind it, there is a sensation center. I'm cold, I'm hot, I'm full, I'm hungry. This clothes fits me, this clothes, I don't like it. Then the vision, coordination. This is the center who coordinate our movement, balance, that we walk with a balance. This is a very important center, the memory, our recent and our old memory. Here is our reward. This is the center which tells us how to reward ourselves. I did very good in the exam. I was about 1 week at home, studying 4 hours a day. I didn't have exercise. I didn't go to a party. I didn't watch TV. I didn't go to basketball. I finished my exam. I'm expecting good grades. I want to reward myself. This brain center can tell me to reward myself by good sleep, then I go to exercise, by a good movie, by reading Quran, by going to the center and sharing with activity, by going out with my friends, by smoking a cigarette, by vaping, by taking a vape, by smoking marijuana, by taking 2 shots of alcohol, by going with my friends who drink. I don't know, it's not the time for the friends who do not drink. So the center of reward, who tells me how am I going to reward myself. Another center of the judgment. it goes with me, I can do that. No, I cannot do that. No, it's against my ethics. No, this is with my ethics. This is good, this is bad. Will affect my memory, this will not affect my mood. These are the center who tells me what to do and what not to do. And this is the most important center that the parents work on. All what we are doing as parents are collected and stored at this center. We learn, our young adult, all what we teach them, all what we raise in them for ethics, to do what and to not to do what, is it collected in this center, the judgment center. Okay, it is the purple one, the judgment center. Okay? What marijuana comes and do? This is a normal brain. Okay? Marijuana enters now. Okay, okay. Thank you. Okay, so anyone who tried marijuana, even for once, or our young adult, when they go and listen about marijuana from the other peers, they will witness and they will say to you that we know that our friend or the party, many of the party boys or the party team were high, they're laughing a lot, they're moving a lot, they are very popular, they think fast, they move fast, and they feel relaxed. Yes? Do they say more? Let's talk about it. What do they say about marijuana? So what do you hear about it? What do you know about it? Huh? It's bad. All of your friends are saying that this is bad? Not even one say that it's good? Okay, good. The first hour in marijuana, the science tell us that the first 3 hours for marijuana, it gets high mood, relaxation, love. But at the same time, there is a delay reaction time, coordination change. What do they mean by delay reaction time? Delay reaction time means that if this bottle is here, I see it here, away. I have a disturbance in my vision and my perception of time. If it is 6:10 now, I feel that, no, it's still 4. How does it come that it is 6? If it is 10 p.m. and I have to go home, I feel like it is 7, and I still have time. So delay reaction time means that I'm not aware accurately about how the time passes. And disturbed delay reaction time, my reactions are delayed. So if I'm driving while intake of marijuana, and another car, or I have to frame or to stop, my reaction will be delayed. So I may have accidents because I see the front car is here, but I see it here. So I will stop late, and I may have accidents. I may make accidents. Do the one who are taking marijuana know about that? No. They know that marijuana gives high mood. We are relaxed. We're laughing for the first 3 hours. But they're not aware that they have delay reaction time. They are delayed in their reactions, and they have coordination change. But anyone who knows that this guy is under the effect of marijuana, he definitely noted that his walk is not normal. His movement is not normal, because marijuana back affect the movement center, the coordination center, and the judgment, and the vision. For the movement, they're moving, but they're not very well coordinating. And there is the memory register the experience. The experience is registered in our memory. Oh, we're laughing. Oh, I'm relaxed. Oh, I'm good. But the memory is not registering that I'm not able to walk effectively, and I may have, I'm seeing things away of the reality, and I'm delayed in my reaction. And I see the hours, my perception for time is lost. That's why the smoking boy or the smoking young adult comes late to home. Because he suddenly finds that, oh, it is 11 p.m., it is 12 a.m., because he has a delayed reaction time and problem in the sense and perception of time. What about the second 3 hours? If I take marijuana now, for the first 3 hours, I'm going to laugh and I'm going to relax. Second 3 hours, I'm going to eat. It increases appetite for the second 3 hours. But on the other hand, there is a sense of avoiding responsibilities. Everything could be referred. I can do homework tomorrow. I can go to school after tomorrow. I can make an excuse of not going to work. I can refer the exam to next semester. For the second 3 hours, everything could be referred. I can go home at 11 instead of 10. I can tell my mother that I stayed at my brother or friend house instead of X house. So the second 3 hours, the thoughts about referring responsibilities and avoiding responsibilities is happening. But the young adult is not aware of that. Red eyes, of course. What about the third 3 hours? The third 3 hours, he wants to sleep. That's why when he comes back home, the second day, he sleeps and he wakes up late. Because the last 3 hours, he wants to sleep. What about 6 months or 1 year later? If the young adult continues to smoke for more than 6 months, more than 1 hour, from 6 months, to 1 year later, definitely, it is addictive. Decreased attention will happen. Perception will be affected. What is perception? Sense of being attacked or persecuted or scoped. The young adult will start to feel at home that everyone is looking at him. Nobody at home is busy but for him. A mother wakes up in the morning, only take care of me, and that's all, concentrating, scoping at me. Everyone is attacking me. Everyone is blaming me. Why me? Why me? Look to my brother. Look to my sister. Look to home. Look to your husband. So the sense, the perception, the young adults start to feel that he is the scope of attention and everyone is against him. Disturbed social cues. He starts to negatively understand the others. We give him cues of affection, we give him cues in conversations, and he starts to negatively misunderstand all the cues around him. And very important things start to happen. IQ change. You know what does it mean by IQ? That my young adult is intelligent and he becomes less intelligent. This is an evidence-based research that tells us that the IQ, the intelligence of the young adult taking cannabis more than 1 year, his IQ will be less 8 points. The normal IQ is 100. So if my young adult is 102, 105, 110 IQ, after 1 year of cannabis intake, he will be 90 as an IQ. This is a fact. This is a science. If they open SAMHSA, they will read that. If they open NIDA, they will read that. If they open any scientific textbook, they will read that. Okay. So approximately, this is the SAMHSA research, 1 every 10 people who use marijuana will become addicted. So if we have 10 young adults who start to smoke marijuana today, 1 of them will be addicted after 6 months, and the other 9, they may quit, they may go into irregular use, they may get feared, they may, once they are detected, so they are punished, so they do not take again, many stories. But 1 of them, 1 out of 10, will be addicted, and if his age is younger than 18, it's 1 out of 6. Under 18 years old, 1 out of 6 will get addicted to marijuana. Okay. You can also show them, you know, something called scan, you know, the MRI scan, CT scan, these scans for the brain. To the left side, this is the normal brain, and to the right side, this is the cannabis use brain. The more the blue color in the scan, this is an investigation called PET scan. It evaluates the amount of oxygen, the amount of nutrition, the amount of glucose inside the brain cell. The more oxygen, the more glucose in the cell, the more the cell is healthy, the more the cell is thinking and functioning well. If you notice, on the left side, this is the normal brain, blue color. What about the right side? Can you notice the blue color? The blue color is much less. This is after 6 months of cannabis use. Less oxygen, less glucose, less nutrition for the cell. This is a slide we can see and discuss it with our teen, with our young adult. Okay, how can we answer the issue of legalization of marijuana? So Dr. Rania keeps saying that marijuana is addictive, So why is a state like Colorado, the first state who legalized marijuana is Colorado, followed by Texas, followed by California, followed by New York, followed by others. Let's see the Journal of Missouri Medicine for 2020. They evaluated the legalization of marijuana inside Colorado state. Let's read together with our young adult this report from Colorado state, the same state who legalized marijuana. Section 1 in this report say that since recreational marijuana was legalized, traffic deaths in which driver tested positive for marijuana increased 109%, while all Colorado traffic deaths increased 31%. You know what does it mean? 109% increase in the death because of marijuana in drivers, while the whole increase in the traffic deaths was 31%. Since recreational marijuana was legalized, traffic deaths involving drivers who tested positive for marijuana more than doubled from 55 in 2013 to 115 people in 2018. بعد ما كان 55 واحد بس توفوا من حوادث سيارات 2013 أصبحوا 115 who died from accident due to marijuana intake. This equates to 1 person killed every 3 days in 2018, compared to 1 person killed every 6.5 days in 2013. Since recreational marijuana was legalized, the percentage of all Colorado traffic death that were marijuana related increased من 15. It's the same. I'm sorry. What about the marijuana used in Colorado? Since recreational marijuana was legalized, the past months marijuana use for age 12 and older increased 58% and is 78% higher in the national average, currently ranked the fourth in the nation. Adult marijuana use increased 94% and 96% higher than the national average. The use of marijuana among age 12 to 18 increased. And the use of marijuana among over 28 years old increased. The college age marijuana use increased 18% and is 48% higher than the national average. يعني Colorado is the higher state of marijuana use after legalization عن the whole nation. Youth marijuana use decreased 40% and is 40% higher in the Youth marijuana use increased 14% and is 40% higher than the national average. I mean that it is 40% higher than the other nations, than the other states. I have to be acquainted with the American terms. The yearly number, let's make high attention for this. The yearly number of emergency department visits related to marijuana increased 54% after the legalization of recreational marijuana. From 2013 to 2017, the ER visits from marijuana is raised 54% than 2013. Hospitalization from marijuana reasons increased 100%. 100% زيادة. 100% زيادة الأعداد. 100% increase in the hospitalization. Marijuana use only exposure more than the quadruple in the 6-year average since recreational marijuana was legalized. It means that the young adult is 4 times exposed to marijuana use after its legalization. In 2013, while Colorado was not legalizing, every young adolescent could meet marijuana use 1 time. In 2017, it could meet it 4 times per week. Yet, so why legalizing? This report say, why legalizing from the first place? The decision for legalizing marijuana is political. It's not a medical decision. Psychiatrists and doctors and physicians did not take this decision. Marijuana legalization is not a medical, nor scientific, nor physician decision. Legalization means that it should be sold, so we can take taxes upon it, and these taxes would be distributed or be covering the treatment. This was the concept of the government. Will decrease the load on the prisons, will decrease the load on the police departments and inspections. This is the reason. And we will take money, and this money will be for funding the treatment. Yet, marijuana tax revenue, see the first statement in section 5. Marijuana tax revenue represent approximately 0.9% of Colorado budget. So if we want to do this to raise the tax, actually it is less than 1% of our tax. So what was the reason for the decision? So when we discuss this with the young adult, we say that legalization of marijuana does not mean it is healthy, does not mean it is medical, does not mean that science approves it. It's for police reasons, tax reasons, political reasons. It's not healthy. I did bring with me certain materials, tips for the parents, how to talk about the prescription drugs and how to talk about marijuana, to answer the facts about marijuana with our young adults. The only thing I want you to take care for while we are discussing that our reference should be science. Let's talk with our teen and young adults with our reference is science. Research says, science says, our religion says, the logic says, the culture says, but not a certain website say, a certain friend says, a certain family do such and such. Our reference usually should be scientific, according to report, the certain report, according to certain research, according to certain book. So if we are avoiding any judgment, it's not my judgment. With my young adult, I'm preparing him to be an adult, so we have to discuss and we have to have a very good skill called active listening. Most of us forget to listen. We forget to listen. We know the answers, we are the experts, we know everything, and we answer everything. So we always playing the role of the expert, and they have to be always the listener. No, 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 no. Unfortunately, no. We're not the expert, and they're not. We are interacting together. I should listen. Even I am listening to disasters. Even if I'm listening to haram things. Even if I'm listening to a very frightening experience my young adult is coming to tell me about. I have to listen, smiling, be cool, be quiet. More and more talking will be done. More and more acceptance. We have to save what? I made it here with a red way, a safe space. Every young adult has something called a safe space. He needs to feel safe inside home and a safe space where he can talk, he can express, he can tell what's happening. And let's learn together what should be and what is my value, what is my concept, what is my reaction, what is my attitude, what is my practice. So a safe space is our key. A safe space provided. I provide a safe space to my young adult. This is a crucial point. So I have to be actively listening. I'm not the expert. A safe space for my child. Let's go away of any judgment. Failure. You're a loser. You're an L. You know nothing about it. أنت حمار. أنت غبي. أنت فاشل. Anything of these things. So, discrimination. You're much better than those stupid you are talking about. No, you're a loser like them. Look to your brother. Look to your older sister. Look to your neighbor. Stereotypes. No, God, no. We're not like them. They are such. You are such. Stereotyping people. And he goes to the community this community is stereotyped at home, and he is one of this community. Let's imagine on reality basis what's happening. We are inviting him to stereotype while we are pushing him to live in this with those stereotype people. How is that? How is that? So I am not the expert, and you are not too, and let's consult and read together. Let's read textbook, let's go to reports, let's go to research, let's go to a psychiatrist. Let's fight stigma. We're not judging each other. We're not judging others. We are one of those communities. They are our brothers. They are our compatriots in the nation. Again, I'm repeating the parenting skills again and again. And I hope that here the Islamic Center will disseminate this presentation on all of us. Do not lose hope in talking. The young adults keep our talk in their judgment center. Although they show us that they're not interested, we don't understand anything, we don't understand them. We're totally different, we're raised differently, the community is different, our friends are different, our attitudes are different. They are always telling us that. Yet, all researches done inside the US and outside the US tells us that the young adult keep his parents' statements in his mind, although he's showing the opposite. So don't lose hope in talking to them and listening to them while we are not experts. Let's fight stigma. If we have denial, if you see a family who has a certain denial about certain one of their family member, one of their child, let's go and help them. Let's tell them that we, in the future, in the very coming future, we will be having regular courses, regular workshops about the parenting skills, the marijuana, the cocaine, the whole drug use problem, how to fight suicide, how to help my son or my young adult if he faces a problem of suicide, self-injury behavior, homosexuality, sexual problems, he's not fitting in his own community. All of those, we will be having regular online workshops together to discuss tips for us to help our young adults. Thank God. Thank you so much. الوصمة. أيوة أعمل إيه؟ Yes. How to fight stigma. Thank you, sir, for the question. There are two lines to fight stigma. First of all, I am expressing my own problems without fears. So I go to Dr. Muhammad, to Mr. Yusuf, to Omar, and I tell her my own problems. And I go to my neighbor, and I tell him, yesterday I went to Dr. Muhammad and I discussed with him a family problem regarding my son, and we agreed that we do this and this and this in a respectable way, in a confidentiality way. Everything will be confidential, everything will be respected, all problems will be respected. Another way to fight stigma, that it's okay to have problems. It's okay. It's okay that my son have an educational decline. Suddenly, he has a concentration problem. It's okay. This is a symptom in a disease. It's not a shameful problem. We have the medicines and we have the techniques who lets the young adult go back to be attentive and go back to have high concentration. This is a sign, just like the flu, just like the heart attack, just like the urinary stone, just like the cough, the productive cough. Everything has its treatment. So the lack of attention, the aggression of a young adult, the impulsivity, these are symptoms. We have medicine for it, and we have techniques to overcome it. It is a disease, the disease concept. It's not a social problem, it's a medical problem. So the medical point of view, or the medical perspective, will be fighting the stigma. This is a sign in a disease, and this disease has a treatment. It's not a social problem.
جزاكم الله خير. مرة ثانية round of applause للدكتورة. الله يرضى. بارك الله فيك دكتورة. I know that we put you in this situation to give maybe one course or two or one semester in one lecture. But thank you very much for your great work. Now we have many questions from our brothers on the Facebook and YouTube, but if you have any question, our brothers who are here, inshallah, so you are welcome. Any question? from الشباب أو البنات أو our sons, daughters, anybody is welcome to have. Okay, عمر.
To talk about the drug problem or
Any problem, any problem, any issue, any mental issue. How to
you want to
make our
encourage
children-
the young adult or the parent? Ah. Okay, let's go back. Begin by yourself. Let's begin by ourselves. Oh, I came today from work. I'm so dull today. Today it happened such. My manager said such. The pharmacy was like such. The school I did such. I was happy today for such. I was angry today for such. I begin with myself. Okay? And we eat together. In the middle of eating, let's define certain time at the day. We should be together. After PM, 8 PM, in front of the TV, after the prayer, before the prayer, after studying, after dinner. Then I begin with myself. Then I listen. So how was your day? How was your school? Ask general questions. Then give him the free space and the safe space. The more he talks, he has to see your smile, and he has to see acceptance, and with no reactions, bad reaction. Oh, ya nahar abyad, ya nahar iswad, no, we don't need that at all. Do not panic. Do not panic, and let's give the young adult that we are eager to listen. We are eager to know. Oh, then what? Then what? What was his name? Oh, I like this guy. Oh, I like this. Start to joke. Accept joking. Ask open-ended question. You do know what does it mean, open-ended question? How did you feel about that? بلاش نقول, let's go away of this is bad, this is good, this is wrong, this is halal, this is haram. You end the conversation like this. All judgments, we end the conversation. So how is he going to continue the conversation? Okay, this is bad. It's enough. The conversation is ended. But how did you feel about it? Oh, I'm wondering what happened later on. I'm wondering if I am, instead of you, how would I behave? Oh, you're so brave that you do that. Thank you so much that you did that. I appreciate that you are very courageous with your friend. How did you help him? Do you feel you need to help him? Open-ended question is the key. Close-ended question will close the conversation. Okay? Do not interrupt. Do not order. Do not see this man again. Do not see this guy again. Oh, this is a stupid guy. Do not see him again. This is an order. And it ends the relationship. And it ends the safe space. Go away of interrupting or ordering or stereotyping.
Very important, wallahi, advices. جزاكم الله خير, دكتورة. My question now, Doctora, of course, maybe one of the worst issues between the family members now that we have lack of communication.
Yes.
Lack of communication. Most of children, our parents are busy with the Facebook, with TikTok, with the Instagram, with others.
Yes.
Everybody has his Word with his iPhone, and so what is your advices for the family in this side? Second, unfortunately, we have sometimes misconnection between the generations. the young generation and the old generation. And it is, of course, between parents and children. Sometimes we don't understand, misunderstanding of each other. So how can we solve these issues? Allah يبارك فيكي.
You know, Dr. Muhammad, there is a complete workshop about communication skills between parents and the young adulthood. Parenting skills, they are 10 tips, 10 skills parents should have in order to raise young adults. None of them is feeding, nor sponsoring, nor sleeping, nor eating, nor studying. These are not the parental skills. Parental skills are 10 skills where number 1 is communicating healthy with them. How we communicate healthy with them? First of all, active listening. Let's listen first. Let's gather cues and we gather information. How are we going to form the mind of the young adult without listening to him? So, number 1, active listening. Number 2, open-ended questions. Number 3, we open discussion. How are we going to behave? What will be our attitude of this? So what is your concept in doing this? How did you decide to behave in such event? I'm not telling him what to do. He is a young adult. We prepare him to be an adult. So we prepare him to think and to take decision and to have a concept and to have an attitude. Who will be training him of all of this? Us as a parent. So let's listen, then open-ended question, then ask him about his concept, his attitude, his behavior, his decision. And when you don't like his decision or concept or attitude, continue to discuss. Do not get angry and do not end or interrupt the conversation. Why did you choose this decision? Is it you are reluctant, you're frightened, so what do you think God will be thinking about your decision? What would you think the community? What do you think your father, what will be your abilities? Is it rising? Is it decreasing by those decisions? So continue discussing and also experimenting. Sometimes wise parents, smart parents, do experiment with their children to lead them to the good decision. Okay, let's try what you say, and we have expectation, and let's see the experience what will be telling us. These are smart parents. Okay? I can make this workshop, communication skills, for
very
the
soon,
parents.
inshallah. Any question, Dr. Akh Mus'ab? I think. طيب, also another question, Doctora. يعني, as a family, and I think you answered this question, but I want you also to talk more. When any child has a problem of marijuana, so what are the steps or the steps from number 1 to, inshallah, the solution? Because I think we need prevention before, but at the end we need recovery. So is it treatable, especially with the rehab, or so what is, because when we have a problem in the community, they call the sheikh and they think the sheikh will solve the problem. Sometimes they ask the sheikh to read Quran and to make ruqya and alhamdulillah and make dua. So of course dua is very important, ruqya is very important. Prevention is more important than anything first, and second, we need the recovery. The recovery, so what now, I know that some parents are very upset, they become very angry when they know about the problem. So what is the first step until the end? Very quickly, I know that it needs a lot of work, but it is a message now for our community. This is number 1. There's another question. As a community, how can we face and challenge the drugs? I think it is a big issue. We will talk about it, inshallah, in different forums. But now, what is the message for the parents from step one to the end. Very quick, please.
Step one, that if any one of us noticed the use of, suspected the use of the young adult of any kind of drugs, he has to pay attention more. No facing and no confrontation before having facts. Suspecting only is not enough. Let's have facts, let's have evidence in our hands before confronting. So let's supervise more, let's take care more, let's spend some time in noticing and supervising or paying a certain attention with the young adult. If we are sure of the intake, if we find things at the room, if we know that he is hanging out with certain people who are known to smoke or to take any kind of drugs, if we have, beside an educational decline, beside a high absenteeism from the school, beside losing weight, mental problems, sleep disturbances, so let's do not fear of the psychiatric evaluation. Psychiatric evaluation is the second step. After confronting the young adult that, okay, we noticed your educational decline, we found those things at the room, you are coming back late, and we did really advise you 1, 2nd, and 3rd time. Okay, this is the 3rd time we are telling you to take care or to stop the drug use, yet we don't find any change. So what about going into a psychiatric clinic, because 80% of the substance used are treated inside clinics. We do not need hospitalization except in the severe cases. The mild cases, the moderate cases could be treated in clinic setting, in outpatient setting. The inpatient setting is for the severe cases. After 2 or 3 trials in the outpatient, failure, yet the child or the young adult go back to relapse and go back to use substance. So the 4th trial in treatment should be into hospitalization. But first, 2nd, and 3rd trial, all of them should be in the clinical setting. So why we do not make an evaluation, and if we see your use is mild or moderate or severe, there is a professional psychiatric evaluation of the drug use, questions and answers, and those answers enter into the computer, and the computer gives us standardized evaluation. It happens in Egypt, in the US, in Germany, in the UK. It is the same evaluation called Addiction Severity Index. This Addiction Severity Index is done all over the world. It's a standardized evaluation in all countries. Either the result will be mild use, so mild use has its own program. Moderate use, another more extensive program. Severe use, okay, much more extensive clinic program or hospitalization. So the first line, good supervision. 2nd line, nice confrontation with the young adult, inviting him to seek, both of us, we will be seeking help. We will be seeking evaluation, and the evaluation will say, the science will say its decision. It's not me or you, it is the medicine, the science. Either we will be mild or moderately or severely intervened. 80% of the problems are treated inside the clinics.
Which stage?
What age?
Stage.
We know as they started using marijuana, or they, they're down deep into it, or from even there is only suspicion, or what do you think?
There are 5 levels of substance use. The first level is let's say the experimental use. I heard about it, I am in a party, and I used once, and that's all. Experimental use. It's not a disease. Second level, social use. I'm using also only in certain events, in certain parties, with certain friends, in certain events in the year, not more than 3-4 times a year. This is called social use. Third level is regular use. I smoke every weekend. I smoke every Saturday and Friday. I do alcohol every Friday night. Regular use. Experimental use, social use, regular use are not disease. They're not our clients. Substance misuse, drug misuse. Misuse stands for what? I started to have symptoms. No, it's not only for the weekend. I use it 2, 3, 4 times a week. After my work, before work, after my private lesson, after school, before exam, after exam, 2, 3 times a week. This is called substance misuse. It's no more social, it's no more experimental, it's no more regular. Even regular use, we have issues. As a physician, we have very serious issues with the regular use, because the young adult, it has a growing brain. Even the regular use is very harmful on his brain. The brain is completely mature at 21 years old. Less than 21 years old, the brain is still growing. So if I'm regularly using cannabis or alcohol every week while my brain is still growing, so he will be growing wrongly. The brain cell will function wrongly. I'll be more impulsive, more angry, all depressed easily, anxious easily. Okay? So even the third level, regular use, then substance misuse, then substance dependence, addiction. So level 3, 4, 5 are our clients. Level 1 and 2, experimental use and social use, they're not patients. They're not the one we are talking about. He experimented once and he stopped it. Okay, it's his age, it's his experience. He does that on social basis, on certain events, maybe 3-4 times a year. No problem. Okay? From the physical, from the medicine point of view, it's no problem. From the religion point of view, it's haram totally. Okay? Third level, regular use. If it is a young adult, it is a client. He has to seek psychiatric help. Then substance misuse. 2-3 times a week. I'm increasing the dose. I become less happy without it. I'm searching for the drug. I'm looking for the friends who has my drug. I'm searching for money. I'm not able to study. I referred exams. I'm shouting. I'm insulting. I'm going back late. I'm not sleeping. I'm sleeping a lot. So these are substance misuse. Then addiction. The fifth level is addiction, and this is completely a disease.
سبحان الله, Allah subhanahu wa ta'ala said in the Quran, وَلَا تَتَّبِعُوا خُطُوَاتِ الشَّيْطَانِ. Don't follow the steps of the shaitan. So the shaitan will start from step 1 to step 2 to step 3. And always I talk to our people, this even the regular cigarettes is haram because of that. Because especially for our children, on young children, it is the door for smoking the marijuana and so on. There is a question, and Ahmed, maybe you can also share if you like, which is, unfortunately, some of our young adults think if it is taken for medical reasons, then it is not bad for your health. Because some of our family, community members, or some of our children, I use it for medical issue. It is better than other types of medicine, and also the physicians said it is not harmful, it is not addiction. I think you mentioned some of this before.
In this slide, the prescription drug use.
I want you to send a message for our community or for our young children that what you, I don't want to say
Yes.
what is that message, but what is the message from you,
A
doctor?
prescription done from a physician to increase my attention will be 1 tablet once in the morning for 3-4 months. Then after the exam, after the summer course, after the education, this medicine will be stopping. This is completely medical and this is a normal practice. But the young adult learns from his peer that this medicine made him attentionally good. So instead of taking 1 tablet in the morning, while he is a good attention in the first place, he doesn't need the medicine. Then they start to take 2-3 pills before exam, 2-3 pills 3 days before exam in order to not to sleep, to stay alert, and to study more. They think that they're not studying more ولا حاجة. It's not really what's happening. They're studying, they're alert, they're not sleeping. Then in the exam, they usually sleep inside the exam, or they usually forget. Because cannabis do not increase memory. Cannabis work on movement, on sensation, on coordination, on judgment, but it doesn't increase memory. So what
I want this picture, please, to be on the screen, and I ask Sister Noor if you please zoom on the screen, because this slide was not seen by our people. So please, I hope that Sister Noor hear us now. If you go to the screen, Jazakallah khair.
For example, marijuana will make us relaxing, then we will be studying. But marijuana do not retrieve information from the memory and do not increase the memory. So the amount of what should be studied won't be increased by taking marijuana. They will be only relaxed while studying. And this is for the first 3-4 months. Later on, 6 months or more, this relaxation effect will completely stop. On the other hand, they have to increase the dose. It has to be 4 or 5 cigarettes per day, maybe more suspicious about the others, and anxiety if they're not smoking, not sleeping well, not eating at all, except if they are re-smoking again. So if I smoke again, I'll get back my appetite. I go to sleep, I can study a little. Why? Because the reward center is telling me that my only reward will be marijuana. Marijuana is my life saving. 6 months later, I forget that exercise makes me energetic. I forget that going out with my good friends makes me splitting from my stress. I forget all of the normal rewarding. And the brain reminds me only with the marijuana. This is caused 6 months later after intake, of the regular intake, the stage 3 of intake. So going back to the prescription drugs, many of our young adults now say that, okay, instead of marijuana issue, legalized, not legalized, not our issue now. These are medicines. These are good for the health. These are no problem. My peer takes it and get good grades. So why I'm not taking this? But is it healthy to take 4 or 5 tablets a day, then 7-6 tablets a day, then 10 tablets a day? Then I go into psychosis because the high dose makes psychosis, aggressiveness, they stay for more than 3 days without sleeping, and they have a very bad mood. Yes. Yes. they smoke to stop epilepsy, or you mean the medical marijuana? Use what, ma'am? But there is no scientific research asserted that medical marijuana is useful for epilepsy. None. No one research says that. That if I have a high electricity in my brain and I am epileptic, okay, this is a medical problem. It has a very well evidence-based medicine and research is done for it. But I cannot smoke in the street, smoking marijuana, in order not to have epilepsy. This is an entirely different issue. If disease is treated by... No, medical marijuana is only for panic attacks and stress. And very minor
And it has to be
disease,
under
and it has to
the
be
medical
in the prescription.
treatment and perception and the doctor and so on. جزاكم الله خير. طيب. I thank you very much, Doctor, for your time. تفضل خبرو.
Yes. Yes. I thought I brought things. So these about prescription medicines, and this, 32 pages for marijuana. It's answer for all they could tell about marijuana in the streets.
طيب, we will send them إن شاء الله on the email for إن شاء الله or على فيسبوك. نحط على اللينك هناك. خلي لي واحدة بس عشان جزاكم الله خير والباقي بالله. طيب, باسمكم جميعا نشكر دكتورتنا واستاذتنا الدكتورة رانيا ممدوح على هذه المحاضرة القيمة المقدمة في مجال مكافحة المخدرات وأيضا بناء المجتمع على قواعد سليمة من الصحة النفسية والصحة العقلية والصحة السلوكية. وإن شاء الله سيكون معنا ورشات عمل قادمة على الزوم أو على الفيسبوك وعلى اليوتيوب، وسيكون أيضا هناك لقاءات مباشرة على أننا إن شاء الله هناك عندنا باب للكونسلينج في المسجد، وستكون الدكتورة أيضا يعني على رأس هرم الإرشاد النفسي الفردي سواء للأخوات أو للشباب. ومرة ثانية نشكركم جميعا ونشكر أستاذتنا الكريمة ونشكركم على الحضور ونشكر إخواننا الموجودين معنا على الإنترنت وعلى الفيسبوك، وجزاكم الله خير والسلام عليكم ورحمة الله وبركاته.
شكرا دكتور محمد.
Anybody wants to put his email address to receive the papers and the flyers, inshallah, just please write it here and we'll send it to you. جزاكم الله خير.
دكتور محمد، أنا عايزين نقفل ده. Miss Rana has the presentation. Have the whole presentation.
She will send it.